So, what do we do? Essentially, WentWest connects services, system, and community. And if you took nothing else away from the next 15, 20 minutes, if you just remember that WentWest connects services, community, and systems, then I've done my job. Essentially, we do that to deliver coordinated, person-centered care. We partner with health professionals across general practice, aged care, allied health, and pharmacy to build capacity and improve local health outcomes. We commission services to fill gaps and support care closer to home based on local need. WentWest work is guided by a deep understanding of the region's health priorities through our needs assessment and close collaboration with our community members, service providers, and our stakeholders to design solutions that make a real difference. So how do we do this? We deliver services by integrating funding models, aligning Commonwealth, state, and community-funded services to deliver patient-centered solutions to our most vulnerable populations. And to do that, collaboration is essential. People don't experience care in silos, as we know. So services must work together, and leading collaboration is a key role of what we do at WentWest. Our role is in connecting with our partners, primary care stakeholders, and yourselves in improving health outcomes, transforming primary care, and reducing avoidable hospital use. This in turn reduces duplication, improves navigation for patients, and ensures that the end goal is achieved, the right care, the right time, and the right place through collaboration across the whole health system. So what's our region? Well, lucky for us, it's the same as yours. WentWest PHN and Western Sydney LHD serve the same Western Sydney region across the Blacktown, Cumberland, Parramatta and the Hills local government areas. And because we support the same population, it's critical that primary care, community health and hospital services all work together. Across the region, there are hundreds of GP practices that the PHN supports through formal training and education, delivered via a few means. Number one, we partner with our subject matter experts, and through these relationships with our partners, we run a number of education and training events, as well as promote relevant external training and education events. We utilise enablers such as digital tools, some that you might well be familiar with, like Health Pathways and GoShare that you utilise across ICH as well. My colleague Gary will talk to those in a little bit more detail later. And of course, we have our practice support function. So we build capacity and capability across the general practices that we work with, of which there are over 325 in our region, building high-functioning multidisciplinary teams, working with them through immense system reform in the strengthening Medicare piece, and supporting an approach for extended scope of practice across our primary care workforce. Western Sydney PHN also supports and commissions Medicare urgent care clinics, New South Wales Health State urgent care services, and Medicare mental health centres, providing alternatives to emergency departments and improving access to care closer to home and reducing pressure on local EDs. Working together across the PHN and LHD strengthen care coordination and improve transition between acute services and primary care, which ultimately improves patient outcomes, which is what we want to do. So what do we do? Here's a bit of a snapshot. It might be a little bit small to see, but you'll be able to see parts of it. At the core of it, our focus is primary care. So everything that is a front-facing clinician, including supporting general practice, allied health, and pharmacy as the foundation of our system. Last year, over $57.9 million was invested across Western Sydney by the Primary Health Network, delivering 105 commission services. Education and training is delivered by a region-wide capability building capacity for GPs, nurses, allied health, and aged care staff. As mentioned earlier, we provide practice support, and last year we conducted over 4,000 points of engagement, improving quality, systems, and patient care, building that strong capacity and capability within the system. We also support pharmacists in general practice, building on that multidisciplinary team approach. In the aged care space, we support over 60 aged care homes through various programs, including the general practice in aged care work, dementia and palliative care, and our aged care on-site pharmacist program. When it comes to chronic disease, we support our practices through various quality improvement activities and implement various programs in association with yourselves with things such as the Western Sydney Diabetes Program, the 2 kilogram challenge, and supporting practices in utilising case conferencing and optimising the way that they deliver care to their patients. In this last year, over 24,000 psychological sessions were conducted through the support of the Primary Health Network, as well as the services offered through our partners within the Headspace and Medicare mental health centres. When it comes to population health, we partner with the PHU and focus on disease burden within our region. An example of that is our annual immunisation bike competition. So last year we had 98 general practices partake in the program, and through that delivered immunisations to over 400 children. This year, that grew to 146 practices and over 800 additional children supported by the program, of which they received little bikes at a prize winning ceremony, which they all loved as well. We also deliver a number of urgent care alternatives, 3 urgent care clinics and 3 urgent care services. None of this is possible without the strong partnerships that exist across primary care, hospitals, community services and government. So, collaboration is at the key to everything, as we've said. Collaboration underpins better health outcomes, and importantly, between ourselves and yourselves, we share a common vision. That's improving outcomes for our population through coordinated patient-centred care. We already have really strong relationships between Western Sydney PHN and Western Sydney Local Health District, with regular executive, clinical and operational engagement to align priorities and delivery of services. A key focus is integrating acute and primary care, strengthening links between hospitals, community health and general practice to create a more seamless experience for patients. And what's the best place to do that and who to work with? Yourselves, in integrated community health. It's all in the name. We also work closely together on co-design and innovation, partnering with clinicians, consumers and services to test and scale new models of care, a number of which I've heard about here this morning, and we're really excited to work with you on in the coming months. Finally, joint planning and shared data help us understand local needs, target gaps, and invest where it will have the greatest impact, because essentially we're all doing the same thing. We want to create the greatest impact for our patients. So to provide a little bit more information on some of the enablers that we utilise to do that and the services that we offer, I'll hand over to my colleague Gary.
Thanks, Scott. This is going to feel a bit weird for me. It's the first time I'm wearing glasses. But that's all part of healthy aging. Right. Digital tools and enablers. The digital tools turn our strategy into action. One of the first resources we use is GoShare. This is a patient education platform that allows GPs and practice teams to send condition-specific resources to our patients. These include things like digital information prescribing, accessible health literacy resources, and video and print-friendly materials. Health pathways. So this is a tool that we're all familiar with. Provides localised treatment and referral information to health professionals at the point of care. This enables clinicians to have better conversations with patients, make informed decisions at presentation, and use data to proactively identify and manage risk. This allows for primary and secondary care integration, available across the LHD for use, and guidance on local referral options and resources. Another enabler is Health Direct. This is a free, trusted health information. This is funded from the Commonwealth. It acts as a service finder directly, 24/7 advice on a dedicated phone number. It is the most secure video call telehealth platform to help people access the right care. This is something that we promote in our residential aged care homes along with general practitioners. Also the Lumos and diabetes dashboards. It's where we gather and analyse hospital and primary care data to identify areas of focus to support the most vulnerable. With these dashboards, and together with GoShare, Health Pathways, Health Direct, these are collectively used across ICH and the Western Sydney PHN, supporting quality improvement, coordinated care, and better outcomes for Western Sydney communities. Western Sydney Diabetes is another great collaboration with yourselves to improve health outcomes in Western Sydney. This integrated care approach connects hospitals, community health, and primary care through shared care models. Through primary care support, we're building GP capability, through education, quality, and improvement in care pathways. And also the 2 Kilo Challenge. This is a free program for adults who have pre-diabetes or at risk of type 2 diabetes, and it provides simple, practical tips to eat better and live healthier. Just want to get this all up at once. Collaborating for healthy aging. This is, for those that don't know me, I work managing the healthy aging portfolio with the Primary Health Network. It's been great to collaborate with you guys on various things that are happening at the moment. With healthy aging, we're supporting general practitioners to identify at-risk older persons. We're about to embark on some workshops in May across general practice and aged care nursing around frailty screening. Improving medication use in community and RACs. So as Scott mentioned before, we have over 60 residential aged care homes across the LGAs. We support the aged care on-site pharmacist initiative. At the moment, we have about 10 aged care homes that now employ an on-site pharmacist. Improving immunisations in residential aged care homes. So we've been collaborating with the Enhanced Immunisation Support Program to further understand. To further enhance the vaccination rates across our aged care homes. The care at home is a big piece of work that we're working with you as well, which is really great to collaborate with. The Hospital in the Home program. Where's my mate Gyro? Here he is. Gyro, sorry about yesterday, mate. Parabet the Dragons, but anyway. That's why I'm in a good mood today. So we're supporting the uptake of the Hospital in the Home program across our aged care homes. It's been really pleasing to see the feedback feed through. We'll be continuously encouraging that to support, expand the capacity, continue to support the capacity of HIF to our general practices as well as its capability grows. I feel this is really just about care at home at the right place at the right time, and ultimately reducing avoidable hospital presentations. The PHN, we have a strong relationship with Dementia Australia, so we work with them on flexible training opportunities for aged care homes, general practice and community members. One of the more popular ones is, I know the picture's probably a little bit small on there, I could probably get an idea of that, is the immersive VR virtual reality training, where they get to experience what it's like in the world of someone with dementia and really understand what they see, hear and feel. And we also commission Dementia Care Navigators. As Scott mentioned before, we do commission all our services out depending on the local needs. And we have a resource that supports people living with dementia and carers living with dementia from COLD backgrounds. Another big piece of our work is palliative and end-of-life care. So with collaboration to improve access and quality across Western Sydney, this includes a cross-sector partnership with the RACs, primary care, yourselves, peak bodies and community. So we're also working with the end-of-life support program, where we'll be going into aged care homes, supporting them with training and understanding, recognising end-of-life signs and symptoms, getting advanced care plans used, documented, encouraging conversations around end of life, just so that people are more prepared. And also GP-driven priorities, clear end of life and palliative care definitions, better information, clear referral pathways, and stronger LHD links. So we are working with Dr. Sally Greenaway is hosting a webinar tomorrow evening to our general practices around palliative care services and access. I believe there's close to about 90 people registered for that at the moment, so that's really pleasing to hear. And I think our last slide is just any questions. There's a QR code up there for anyone that that's super keen. Otherwise, just the email address there, support@wentwest.com.au. I believe that stands out in the other room as well. So I really appreciate your time, particularly after lunch. It's a pretty tough time slot. Everyone's all excited for with us.
And if you scan that QR code, it'll take you to our annual review to have a look at a number of stats there around what we do in the region and how you might partner with us. Thank you very much for your time.